Hi, Michelle. My name is Diamond. I'm an occupational therapist here in the hand clinic. How are you today?
I'm well.
That's good. So, I'm going to be here for about 10 minutes, just going over some basic information about your diagnosis in my chart today, and just to answer some of your questions that you may have in regards to your condition. So,
Okay.
first, I want to say welcome to the hand clinic. I always think this place is so cool. And before I started school, I didn't even know that this was even a real thing. So, I always just say welcome to the patients because it's a cool place to me.
Thanks. Before I had this condition, I didn't know this place existed. So thanks. Thank you.
No problem. So, in the chart today, I see that you were diagnosed with CMC joint arthritis in your thumb.
Yep.
So, did you have any questions around your current diagnosis? Excuse me.
Not so much about the diagnosis, but more about what what are you going to be assisting me with?
So, I'm an occupational therapist here. So, for today, like I said, just going to be a brief introduction to your condition and also just some ways that we're going to be working with you in the future going forward. So, not really doing intervention today, just kind of talking about what intervention may look like for you and also kind of decreasing those pain symptoms that you may be having due to your arthritis in your left thumb, correct?
Yes.
Okay.
Yes.
So, just maybe I can start off by asking you what kind of symptoms you have been experiencing or what kind of things you've had difficulty performing.
So what originally made me come in is just grasping bottles, like opening cans, typing at work. Like there's the stiffness and pain that I often get. So I thought I'd come in because that's not normal. That hasn't always happened. So mostly it's the pain. It's the pain of holding things or like when I'm cooking, those types of things.
Okay. So yeah, so those symptoms are pretty common and luckily you were able to come in early enough to get diagnosed. So like I said, you do have arthritis of your left thumb. So that's kind of like at the base of your thumb here. So there's a joint here that connects your wrist and your thumb together.
Mm-hmm.
And so there's some cartilage that is around that joint. And so over time, as you use your thumb, it deteriorates. So osteoarthritis is a pretty common symptom or a pretty common condition in the hand.
Okay.
So women over the age of 40 are more likely to have this condition.
That sucks. Yeah, okay. That makes sense. That makes sense, I guess.
So
We use that the most, yeah.
yeah, this is our thumb. We use this finger the most. It is the most mobile finger of all. And so I didn't mean to offend you with the over 40
No,
comment.
that's okay.
It's just a common condition that women have around this age, and especially with like you said, over time you use your thumb and you use it when you grass, you use it when you cook. So, do you have any children?
Yes.
How many children do you have?
3.
Wow. So, I'm assuming that you may be doing a lot of grasping and gripping movements throughout the day, and you also talked about working. What that has been like. So, may I ask you what that's kind of been like with your thumb?
Well, it just during work it's typing. So sometimes I have pain due to that, but it's mostly with the grasping and holding things that makes it hurt the most.
Okay, I see. So basically going forward, just want to talk about your condition and like your diagnosis and what that looks like for you in the future. So with osteoarthritis in the thumb, it is a progressive condition. So over time, it is commonly known to get worse. But like I said, your doctor was able to diagnose you early enough.
Are there going to be other symptoms that are going to come with this, or is this the worst it gets? Like, and how are you guys going to help me with the pain and like what happens now?
So yeah, so what happens now is that my role as an occupational therapist is to kind of decrease that pain as you are performing those activities
Mm-hmm.
each day.
Okay.
So you were saying the cooking and the typing. So a lot of that looks like kind of stability of your thumb. So making sure it's stable and also doing exercises to making sure it can get stronger. Because with osteoarthritis, your thumb is known to be very stiff. and also just to have less range of motion. So it's not, you can't really move it as often, which I'm pretty sure you have been experiencing, or that's what it sounds like you've been experiencing so far.
Mm-hmm.
So
Mm-hmm.
my role would be to try to find other ways for you to perform those activities without experiencing that pain,
Okay.
and just probably, decreasing, or not decreasing, but slowing down the progression of your disease.
Okay. Got it. Got it. So you said this is pretty common. Um, I'm just wondering, like, what does the therapy look like long term? How long will this be? What type of will I have to do exercises at home? Am I coming, like, can you let me know? Like, I'm kind of nervous about this, so let me know, like, what's going to be happening. What does this the whole process looks like? What does it look like?
So the whole process looks different for everybody. So, like I said, today's just a brief overview of what that could look like for
Okay.
you. So, there may be some thumb exercise that you might have to do at home, but the more interventions that you have, like I said, it can slow down the progression. So, what we're going to try to do is teach you some protective techniques as well until you have that intervention. Because, like I said, as of right now, I'm not really sure what that looks like until after you get evaluated, after you get assessed. So when you come back. So, for example, you may have to do some exercises similar to placing your hand on the table and moving your thumb like this.
Mm-hmm.
And so, also with these exercises too, what I want you to know is that we want to decrease that pain.
That, because I
So,
was thinking, like, that's gonna hurt. That's what you're gonna have me doing. Okay. Okay.
but so the exercises are, so you're supposed to do the exercises to your ability. So whatever your pain threshold is. So we're not asking you to push yourself to the point where you're hurting even more.
Mm-hmm.
So it's just to increase that range of motion, because we don't want you to lose that range of motion in your thumb. It's still important. Like I said, the thumb is the most mobile finger out of all five of your fingers, and it is important finger for grasping and gripping. So we want to
Yeah.
keep that as, as functional as possible.
Mm-hmm.
So that's just what some of those look like. And also, I can model some protective techniques
Mm-hmm.
that we're going to be walking, that I could show you in the meantime until you come back. So, with these joint protective techniques, what we're trying to do is just not have you cause a lot of strain on your thumb.
Got it.
So, for example, me, so usually you would pick something up, like a binder up like this.
Yeah.
But for your sake, we don't want you to do that, because that's causing a lot of strain on this muscle and on these joints here. And since you're saying that you have a lot of pain and swelling there, so for example, you hold it close to your body like this.
Okay.
This is just an example.
That's a good example because I'm carrying a lot of paperwork and books as I'm working. So
Okay.
okay.
And here, this is your cup here. Could I use this?
Sure.
Same thing. Like I said, the thumb, really important for grasping and picking up objects. So instead of doing it like this, an example would be to hold it like this, close to your body as well,
Mm-hmm.
so you won't drop it. And also, so you're not putting a lot of strain on your thumb.
Okay.
Because you see here, you're holding it a lot of the weight with your fingers and with your thumb. So kind of holding it close here, you have this hand to support. This is just an example.
Yeah, that's good. That's good to know. Got it. Anything else that I should know that'll help me improve, like now and at home and opening bottles or anything else? Because that's good. That's some good stuff. Any other activities I should be doing, or is that just gonna come with time? They'll just teach me things with time.
Yeah, so over time, once you begin your therapy and once you begin your services, they're gonna try to work with you on ways to increase that range of motion in your thumb and also for it to be more stable. Until then, I would be aware of the activities that are causing you to have that pain. So you can even jot it down if you want to, or you could just keep it in the back of your mind, like, ooh, when I lifted up that pot and took it off the stove, that really hurt.
Okay.
So you can keep that in mind when you come back for your next session, or when you start your therapy session. You can tell them, like, that really hurts when I am vacuuming, or whatever activity, or you're typing at work, or you're picking up a lot of paper. So I would just be aware of what those activities are and what um, your thumb is doing in those activities and what it's looking like and what it feels like. And also, I would be aware of, like, more swelling, more pain, more stiffness. If you are experiencing any of that, I would call your general practitioner, just so you can get some type of recommendations on any medications or any type of techniques you can do at home to decrease that pain and swelling.
Okay. Just trying to think if I have any other questions. Um, so I'll let them know. I'll let them know if I have any increased symptoms. But you also said this is common. It can last a long time even. So I'm wondering, are there any other symptoms I should be looking for? Um, Anything to expect? Anything different?
It is common for people to hear like crackling and popping sounds at the base of their thumb. So that's something you can look out for too. But like I said, that's a common symptom, and more so just like the swelling, the inflammation, and the pain.
I hope this isn't a stupid question. What's the difference in swelling and inflammation? Are they the same? No.
So
Yeah, I'm guessing no.
they they are the same in some ways. Sometimes the swelling comes with inflammation. So with the swelling, the base of your thumb is going to be bigger. So with swelling is you're looking for like an enlarged, for some enlargement here. And then so with inflammation, it's kind of red and it's going to be hot to the touch.
Okay, got it. Okay, that's all good info. That's good information. Um, will this ever heal? Will it ever be where I'm after this therapy and these sessions? Will it ever be where I'm not in pain anymore? What do you think? What do you think?
Um, so with osteoarthritis being a progressive disease, um, it is commonly known to get worse over time. Just for uh, example, but this example is, far out the water, not this scenario. But for, someone who has cancer, they usually take chemo treatment to slow down the progression or slow down the spread of their cancer.
Mm-hmm.
So, your case, you don't have cancer. This is not cancer, but with our exercises and with occupational therapy, our goal is to slow down the progression of your osteoarthritis symptoms. So that swelling and that pain. So it may look like you may have to wear a splint. So a splint is like a glove that you put on your hand that helps stabilize that thumb.
Okay.
So it's not moving, or it may get weak as well. So you don't want it to be unsupported as you are doing these activities. So that is what these sessions may look like. So it's just trying to slow down the progression of your osteoarthritis symptoms and just trying to give you some helpful tips at home when you are experiencing pain.
Got it. Sounds good. Sounds good. It sounds like it'll be helpful.
Okay, is there any other questions that you have for me today?
No, that's it.
Well, thank you for your time, and
Thank
it was
you. That
really
was great.
Thank you. It was great meeting you. And like I said, I'm fortunate to say welcome to the hand clinic, but it was very nice to have you here, and we look forward to working with you.
Thank you.